Morning, Cisca. Congratulations on winning the UEG 2018 Research Prize. This prize has been awarded to you for your work in celiac disease. Do you want to just talk to us about the current research in this field?
Yeah, sure. So I have been working in the field of celiac disease for more than 20 years already. And we really have been focusing on the genetics of the disease, being a geneticist myself. And when I started that, we thought that was a really difficult task. And it turned out to be. But nowadays, with the new technologies, it becomes more and more feasible to do genetics. And over those 20 years, we have now solved some 50% of the genetic factors. And now we really have to try to understand what that all means. And that's, of course, also quite a challenge. And that keeps us busy nowadays.
And what was your reaction to winning the prize?
Yeah, I was kind of flabbergasted. I never had expected to win a prize like this. And I feel really privileged and honored. But not only for myself, also for my research group, because that's the only reason, of course, that I win the prize, because we do it as a group. But also for the patients, because I think celiac disease is always somewhat of a neglected disorder. And I think having a prize in that area is important for the patients as well.
And how will the prize money be used to further your research?
Yeah, so what we hope to do is something even more challenging. What we want is to really recapitulate the celiac disease process on a little microchip. And by that, really have a model where we can study the disease mechanism in much more detail. And that's really what we need, because we have to investigate all those genetic factors, but also all the triggering events that are necessary. We know that dietary gluten is one of those, but it's becoming more and more clear that also our gut microbiome and maybe also viral attacks that you encounter early on in your life are important, and the only way to study that is in a model system.
And how might this work affect clinical decision making?
Yeah, so what I really hope is that having a model, and we call it a personalized model, but because we can take the genetics of every patient into consideration, that we can also try and see if there's other ways to treat celiac disease. The gluten-free diet is, of course, fantastic. I think it's the only more complex common disease for which we have a treatment. But at the same time, that also makes it hard to investigate other ways to prevent the disease, because all the funding bodies keep telling you, well, what's the problem? Why investigate this? Because you already have a treatment. And maybe by either trying drugs or other ways to maybe close this barrier where the gluten passes through might be an alternative way to find other ways to alleviate the disease. Mm-hmm. So I hope in future we can contribute a little bit to that.
And what would be your advice to researchers thinking about submitting their project for a UEG Research Prize?
Yeah, so I think those research prizes are really there to advance science. And that means that you have to come up with an idea that really goes beyond our current thinking. So you have to be a little bit brave and try to think out of the box. And I think you always have to do that as a researcher. If you want to advance the field, you have to try to really go beyond what you can really imagine today. And that's what I have tried with this grant proposal. And that also means that you take a risk, of course, because maybe it will never work out. But even not, then there's always something that you learn from it. So that would be my advice. Really try to be brave and try really new directions.
Thank you very much, Cisca, and congratulations on your award.
Thank you very much.